Welcome back, dear viewers. So the Children's Heart Charity Society is a charitable organization that aims to launch organized work to provide everything that can be provided in the field of surgery and treatment of congenital heart defects in children in Kuwait and the world, for the purpose of helping to provide a specialized, high-quality and rare medical service for all cases and families that do not have the necessary capabilities, and countries which don't have medical teams specialized in this field. In order, dear viewers, to know more about the association, its administrators, and the most prominent projects and humanitarian work in which it participates, we are pleased to have with us today Dr. Adnan Alhadlaq, the Vice President of the Children's Heart Charity Association here. Good morning to you, Doctor.
Good morning.
It's a pleasure to have you here on Good Morning Kuwait to share everything really about the association. So would you please tell us a little bit about your work at the association?
Okay, the pleasure is mine. Thank you for giving us this opportunity. So the Children's Heart Charity Association is an association that is established under the Kuwaiti law, under the Kuwait Social Affairs Ministry. We started about 2019, 2020. That's when we got the green light from the government to start our work, although our initial project started even before that. It started with a vision and love to do good for the children with heart disease. We as specialized, because most of the people working on in the group are physicians who work with congenital heart disease, with children with heart disease in Kuwait, in the Ministry of Health and other places. So we noticed that we had a good setting in Kuwait where we are doing surgeries for babies, but we wondered about other parts of the world, and we started getting calls from other parts of the world, such as Yemen and from some countries in Africa, requesting some help with some difficult cases and even some basic cases for the children. So we wondered what is the situation in the other parts of the world, and we noticed that most of the countries around us in Africa and some less privileged countries, the children are dying because there is no access to any medical treatment for them due to lack of infrastructure, personnel and expertise in doing that. So that's where the idea started. We wanted to do something to help these children because we know that they are suffering and the family are suffering. Disease does not affect the patient only, especially if it's a child. It affects the child, it affects his parents, it affects the whole family and the society as a whole. And having a child who is sick, that drains the mother, drains the father, and holds them back. And if you add to that some poverty, and knowing that your child can get a treatment and can live without being able to provide that to them, that adds to the burden on the family. So our aim is to give hope and treat these children, help them survive, extend their life, and improve the knowledge and improve the attitude toward congenital heart disease in other parts of the world. Well, now it is if you have a heart disease, it's a death sentence. No, it's not a death sentence. There is hope for treatment.
Wow, mashallah, Dr. Adnan Alhadlaq, we are really proud to have you here on Good Morning Kuwait to explain to us all kinds of lovely work that you do with our beautiful children here in the state of Kuwait and also outside of Kuwait. So, Doctor, what are your most important goals that you seek to achieve through this humanitarian work?
First and outmost is to save these children. By saving these children, we start a cascade of positive benefits. Saving the child gives the family a chance to have a healthy child who they are raising, who will contribute positively in the society in the future.
Yes.
By helping the child, his needs become less, so the family can then start working and benefiting the society, giving hope to these communities where a father who has a child who is sick and he's seeing him dying in his hand, that they can live a normal life and lead a healthy, good future for them.
Yes.
Also, we are seeking to change to change the attitude toward congenital heart disease, make it a disease that is treatable rather than a disease that ends up with death.
Okay.
As a whole, during our work, we are also educating the local physicians and surgeons and the hospital. We're also affecting the ministries of health for them to invest in treatment of congenital heart disease. We are basically putting a spotlight on this disease to make it a goal for the communities and countries to treat and find medical services for these children.
Yes, mashallah, Dr. Adnan, you've mentioned many beneficial things, especially for children with, as you mentioned, genital heart disease, and you giving them hope, Doctor, really also builds hope for us and our dear viewers watching.
Yeah, and there is
today.
also one benefit that we'd like also we would like to offer our donors also a way to give back to the country, give back to humanity.
Yes.
And by opening new avenues for them where they can contribute positively, we have very generous population, people who like to give, who like to do good, and having other tools such as treatment of the children with heart disease adds also to that diversity that they have for them to contribute and donate for these children.
Yes, inshallah, and I'm sure our dear viewers would love to participate in such a humanitarian, lovely work really for the children abroad. And Doctor, mashallah, you said you have visited many countries around the world performing heart surgeries. Would you please explain to us one of the surgeries that you have had on children?
So we started our first starts were in Yemen and in Morocco, in these two countries, and then we extended further. We started involving Tanzania,
Okay.
and it was one of our biggest success stories in Tanzania. We also extended that to Zanzibar. We have projects going on in Djibouti, and we had surgeries done in Kyrgyzstan for these children. We do have future hopes to extend by sending a cardiologist to screen and look at the children who are candidate for the surgery and preparation, and
Okay.
prepare them for that. After reviewing the needs of these children, we then start preparing the medical equipment necessary. So the equipments are different. So there are hardware that are reusable, such as machines, ultrasound, echoes, operating theater, the lights. These usually are provided in the area where we work. This is what we call the infrastructure where we are working. But there are others that are very expensive and prohibitive, and they prohibit relationships.
Yes.
We need people for our social media who just have expertise and smart and know how to use the social media to promote the charitable work we are doing. We need people who can take the pictures, the images, the videos we take during the trip and
Yes.
edit them, add them, and make them in a way that we can present to our society and our donors, so that they would be able to understand the importance of this work we are doing. We need people for booking tickets. We need people for organizing the meetings. So every person who would love to contribute, they would find a place for them with us, and we'll find something for them to do. And I'm sure they will be adding positively. We have a very friendly and small group of workforce that we will be able to work all together and get benefit. We did have some positive contribution from Kuwait Faculty of Medicine students, where we had they themselves have organized an event in the avenues.
Okay.
To collect charity. So they talked to the families, they
Yes.
explained to them, and that was a very positive contribution from them. So we welcome everyone to come and join us in this effort. And everything they would do, inshallah, God will reward them for it.
Inshallah. Thank you, Dr. Adnan Alhadlaq, for joining us here on Good Morning Kuwait. And I'm sure your lovely messages and beautiful insights from the work you actually do outside and even in our beautiful state of Kuwait has been reached to our beautiful society watching us here on Good Morning Kuwait. So we'd love to thank you for joining us.
Thank you very much for having me. I hope we will be able to summarize what we're doing and show it in a positive way. Thank you.
Inshallah, you're most welcome. Therefore, dear viewers, let's all thank the coming of our guest, Dr. Adnan Alhadlaq, the Vice President of the Children's Heart Charity Association here in our beautiful state of Kuwait. Therefore, dear viewers, we shall take a short break and we shall be right back.